Good evening, everyone. Thank you for joining in. So we're having this session with two of our faculties, Dr. Deepak Bose and Dr. Ramesh sir, who are our faculties for gynec onco and reproductive medicine. So we are having this session to sort of have clear any doubts or discuss about the upcoming NEET SS exam. Uh, so over to you, sir, Deepak sir, Ramesh sir, and we can start, sir.
Nice to see all of you here. I and Ramesh sir will be like, as Yogesh has already mentioned, we'll be just covering few of your doubts regarding the exam. And as you know, the exam is right at your doorsteps. So within a month from today, you will have written your exam. Those who are actually appearing for the exam this year. So basically, what you need to understand is this is a exam. This is an exam after a long gap. You usually have the exams around in August, September of each year, but we did not have an exam in 2024 except for the gap that has happened in the COVID era. So this is we did not have any exam in 2023. So this is the 2024. So this is the exam after 2023 that you're going to write in 2025, and that's on March 29th. Hope you remember the date of the exam, and you don't have too many confusions because you belong to OBGY. You don't have different question paper groups or anything like that. Uh, all of you who have your MD, MS, or DNB in OBG or are likely to obtain that degree by 30th of April are eligible for this examination, and it's a single paper, and you gain eligibility to apply for the posts of courses of MCH or DRNB of gynae oncology or reproductive medicine and surgery. So, and also for that is basically that you need to know. And again, about the exam, you have a question paper that contains 150 multiple choice questions, and that need to be cleared in 150 minutes. So it's a 2.5 hour paper. So, and there were certain questions about what is the kind of weightage of questions or how is the questions going to be distributed. I'll just tell you about some things that we already know. As you know, the this separate paper for the OBGY uh, feeder course or the group as obstetric and gynecology. It started only in 2019. And in 2019 and 2020, the papers for gynae oncology and reproductive medicine were separate. If you wanted to appear for both, you had to write two exams, one in the morning and in the afternoon. So you have a single paper for both these degrees that got started only in 2021. So we have had only three exams with this pattern from 2021, 22, and 23. So if I inquired with some of the people who had written the exams in these years, so it has been varying. You don't have a set pattern or in the regarding the proportion of questions that you get from the different areas, but definitely it is a wise way to put this question paper would be to have a good number of questions both from gynae onco as well as reproductive medicine. So in the initial 2021 paper, they had lots of good weightage of gynae onco as well as fertility, that is the reproductive medicine questions. And again, the rest was actually divided amongst the general OBG, that is the obstetrics and gynecology questions, of which the difficulty levels was like medium level, simple to medium for the gynae onco and the reproductive medicine questions, whereas you had lengthy case-based scenarios in the general obs and gynae paper section. So always keep in mind because you are running against time because you have 1 minute for each question, roughly 150 minutes and 150 questions. So when you have a lengthy case-based scenario, you need to be very vigilant when you actually attempt those kinds of questions. So that was mostly from the general side. But when you came to 2022 paper, the weightage of the gynae onco and the reproductive medicine questions actually came down, and you had more of the general kind of questions being distributed there. And when you come to the last paper that was in 2023, back there you had good weightage again for gynae onco and reproductive, and the gynae onco questions were more case-based scenarios, and even there were a few questions regarding trials also, and the rest was actually distributed amongst the general OBGY. So in general, if you need to understand about how will the proportion be, the gynae onco will have 25 to 20 to 30% of questions. Again, the reproductive medicine again 20 to 30%. So you have a range of, if you have both 30% of gyne-onco and reproductive, then the rest will be only 40% that will be distributed amongst your general obs and gyne questions. If you have less number of questions from the gyne-onco or the reproductive, you have more number of questions coming from the general area. And always remember, the reproductive medicine, these need not be only the fertility or the IVF related questions alone. It is reproductive medicine and endocrinology. All those questions, especially your amenorrheas, and the endocrinology, hormone therapy, everything would actually come in that. You have more doubts, Ramesh sir is there to clear most of them. And so that is also counted under the reproductive medicine questions. So let's see what is this year going to be like. And so basically, you need to have a hold over these two areas. But again, a good number of questions would definitely come from your general OBGY, and that is again based on your final year preparations. So there were some people who were asking, would this be good if you want to join, like apply for NEET SS immediately after your final year exam? There are two things about this. One is about how you want to progress in your career and how well you are actually exposed to the various surgical procedures, because OBGY is also a surgical specialty. So many times there are lots of people who finish off their 3 years in OBGY residency without much exposure to surgical hands-on surgeries as such. There could be a gap between when you join immediately after your final year exam and then you go for your NEET SS. You could face some gaps in your surgical expertise and your knowledge, but especially when you are part of gynae onco course, as I have been. So again, you could actually tide over it, but that gap could certainly be there. Whereas if you finish your senior residency also and then go and approach for your NEET SS especially, you will also have would have gained some more of surgical expertise along the way. But then close as to your final year exams you prepare for NEET SS, there is a higher chance that you're going to um, gain a seat, because scoring a rank is definitely dependent on your final year examination preparation, because you have got a good number of questions coming from the general OBGY sections. If you join much later from your final year preparations, then again this entire preparation becomes a little more cumbersome for you. But again, it's not impossible. You just need to practice well. Again, we went through lots of websites and publishers. We were asking about whether any previous question papers have been published as of now. But the NEET SS OBGYN question papers, previous year's question papers, have not been published yet. So it's all based on recall and whatever questions can come up based upon the different question banks. So again, what is left for you, at least for this last month, is that uh, keep on practicing, especially different MCQs from all these areas that I have discussed. And even you have got good number of MCQs in the Marrow app. And Yogesh would also be telling you about the other grand tests that are coming your way in this month. So please try to give those exams also. And uh, although you need to have good knowledge of your textual material, attempting these in the MCQ format will actually open your vision much more, and you'll be able to tackle these questions more effectively during an exam in an exam scenario. So that is again important. When you look at the general OBGY sections, most important ones that when I went through the different MCQs would be in OBS, definitely the physiology of pregnancy and also the physiology of reproduction, especially ovulation, the embryogenesis, and the development embryology parts. This is again part of, some part is again part of the reproductive medicine sections also. So that physiology part is very important. Again, um, fetal infections, that is all your infections like toxoplasmosis, CMV, syphilis, all those things. Some questions keep on cropping up in these areas. Then your first trimester, it could be ultrasound, it could be your screening modalities regarding the different anomalies or the chromosomal abnormalities. You should be aware of that too. When you come across the different maternal disorders, you are more well versed with GDM, PIH, and multiple pregnancies, maybe because when you have trained. but then you get more questions regarding the liver disorders, epilepsy, pruritus, those kinds of things can actually come up more in your papers. So keep a sharp eye towards these. And when you have case-based scenarios, you can have patients in labor. What should be done next? Very much similar to your MRCUG kind of paper. So then, when case-based scenarios are there, and would you do an ARM now? Would you start an oxytocin drip, or would you do an operative vaginal delivery, or would you take her for an emergency CS? Those kinds of scenarios. So the labor-related scenarios. These are, in a nutshell, about the most important topics that usually come up that I have come across in the obstetrics section. Any questions can come up from the obstetrics part, but these are actually very important, high yielding point topics. When you come to gynae, again the anatomy part is important. Some questions definitely would come across, especially regarding anatomy of the uterine artery, and you can have questions regarding the ureter, something like that, or the internal iliac artery. So the anatomy part questions is important. Again, in your just like you have for the fetal infections, the infections of the genital tract, especially the vaginitis, cervicitis, PID. How will you manage a PID case? These are also like very important kind of questions that they are sure to ask you. Some questions regarding the urogyne part, especially the incontinence, urinary incontinence, and how do you manage, and some prolapse case-based scenario can be kept. So something regarding that. Very important. Another topic is the contraception. So have an idea about contraception, what is the ideal contraception for the different clinical scenarios, that should also be kept in your mind. And again, a word about post-operative complications that have come across, that usually we come across in practical basis. There are some MCQs that you will actually help you train regarding these scenarios. So these are the usual gynae related questions that you can get. The GTN, ovarian cysts, all will be counted as gynae onco questions. So that is again part of the gynae onco syllabus. So be aware of those things. What I've mentioned right now is the topics outside of gynae onco and reproductive medicine in the general areas that you need to be concentrating well. Again, our series of classes or videos that you might have come across, whoever has taken the Marrow course, you would understand that more than equipping you for the NEET SS, this was actually to give you an in-depth knowledge about these different specialities. These would actually help you through your residency period to learn more about the course. Maybe so much of in-depth knowledge might not be what is required in your upcoming exams. Again, it depends upon the difficulty levels of the super specialty kind of questions that come across, that you might be coming across. So you need not, maybe you might not require so much of in-depth knowledge for the exam purpose. But then what we have found is when you work in a cancer institute or in a reproductive medicine center, when you are well versed with the nuances of that particular specialty, especially during your residency period, even if you have not studied so much in depth for your NEET SS exam, that knowledge will come to your help when you go for your actual NCH course and you start working there. Because the basic OBGYN knowledge is not what is required of you when you start your course there. It is only to get you through the NEET SS exam. So never think that whatever you have spent, your time that you have taken for going through these videos and the study material for the NEET SS is never going to go in vain. It is definitely going to help you. And again, if you start in this 1 month that is left for you, if you start going through the study materials, that is your textbooks right now, you will not be able to complete the entire syllabus within a month and then try and practice your MCQs. So if you have already started viewing the different videos, you can just brush through at a higher speed or just skim through them, go through the important points. If you have made notes or something, just revise those important points. Especially if I'm in the gynae onco background, so if at all you need to remember the different staging, what is the basic uh, clinical management of the different stages of different cancers. So if you are able to revise them quickly, that would be more beneficial than going through the entire textbook. The textbooks that are actually followed for the preparation of questions as per se is the Williams Obstetrics, the latest edition, Williams Gynecology, very important. Some questions can also come up from the Novak Gynecology. And regarding the questions from the gynae onco perspective, the Berac and Hacker gynae oncology is what is usually being followed. So you need to be aware of the different topics only. And in that book, you have many more other books which you will come across when you start your career in gynae oncology. But as a basic book, the Berac and Hacker gynae oncology would be sufficient. The books to be followed for the reproductive medicine part would actually be shared by Ramesh sir once again. So these are the basic textbooks, but then going through textbooks from like square one at this point would not be that helpful or that effective for for an exam that is going to come up in a month. So please practice with your MCQs, and you can actually bring up certain questions or queries, or where he can actually help you in this 1 month, where some person had actually mentioned something in the chat like image-based questions. Image-based questions are very important, especially for gynae onco. Those pathology images, one of them would definitely be shown, and that can be asked as a question. So image-based questions, and something where you require our help, we'll actually contribute to that too. And if you have any doubts regarding them, you can actually bring that forth. I think I've covered majority of the questions that we had received earlier. This was about what are the different topics to be focused. Minimally invasive surgery questions. Again, minimally invasive, they might show an image-based kind of question there, or something about neoperitoneum that is going to be created. What are the complications that can arise out of with a minimally invasive surgery? And yeah, that should be mostly about it. Uh, the syllabus distributions, the questions about the previous questions, we were not able to get them. Hopefully, uh, after you guys give the exams, we will get some more recall questions, and we'll be able to create more of a database of these questions. So now yes, files are important for NEET. I'll come across files a bit shortly. Ramesh sir, are you available right now? Or
Yeah.
so I'll just invite Ramesh sir
Bro,
to give
okay.
his thoughts about
Can you
it.
hear me?
Yes, sir. We can hear you,
Yes,
sir.
sir.
Yeah. Deepak, I think Deepak has covered almost everything which is needed for your preparation. From reproductive medicine side, as Deepak said, the sphere of is the Bible basically. So we need not go beyond sphere of. Some people do prepare from big books like Gardner and the stuff. Even I've seen some organizations recommending to read, but those things are as of now beyond our expectations. So generally, square of would be more than sufficient if at all you have read square of during your residency time. In our classes also, we try to cover maximum from square of the things which are told in detail to make the concepts clear and give extra importance to your intersex abnormalities as well as the development areas. Me and Deepak, in fact, wrote the first NEET SS exam. That time, the majority of the questions were from gynae, general gynae only, even prolapse. So many questions are like tuberculosis, so on and so forth. But having said that, of late, last 2 3 years, the pattern is little bit changing. They have because people are more and more people are playing, and so they are concentrating to get little bit tougher questions in between. But still, if when we prepare for our final year theory exams, mainly we see previous question papers and learn only those things. But whenever you come, there is an entrance examination. We have to read in between, not only the general routine questions. We have to put in a little bit more effort to have some idea. If you have a very basic idea, you might have listened about those classes, some basic understanding, then a quick revision would help you to get many of the questions because we try to plan our program for the OBGYN residency program in such a way that you will be having some help in understanding the basic concepts that will in fact help to solve many problem based questions as such. Plus, give some extra importance to contraception and fetal medicine part also, as Deepak had highlighted, it's also equally important. In this high risk pregnancies, fetal growth restriction, but those areas. In fact, you might have prepared those questions during for your MD entrance. So those questions, at least you have a quick brush up from those questions which you have prepared for MD entrance itself. From there also you might get many questions. Apart from that, extra thing you need to concentrate is, as Deepak said, about Barak and Haga for Onco and Sparrow, a little bit detail in reproductive medicine. Sparrow is actually having four parts. First is physiology, and second part is reproductive endocrinology. Physiology, in fact, any small books or any basic book will be fine for physiology to cover in detail. But the second part, reproductive endocrinology, the development of the gonads and all the stuff, it's better to read maximum from Sparrow if time permits. That does not mean that you should waste your whole month in reading only those portions, then you won't be able to cover the entire portion. So you have to plan, give adequate weightage accordingly. That's the main idea. And in the IVF and ART part, for the last part of Sporov, again, it's not a very important aspect when you are considering your NEET SS entrance examinations, because those are mainly topics for to be covered during the super specialty courses. But again, some of the basic, very simple things can obviously come for these things. The weightage part, as Deepak has already discussed, but again, it might vary drastically. Last year, in fact, the reproductive medicine part questions were comparatively very less compared to onco and other aspects. So it can vary. Sometimes the onco questions might be more, sometimes fertility questions might be more, sometimes both will be very less, and you will be having more of general OBG questions. Same like your MD entrance examinations. Even if they have given some mark weightage distribution, those questions, it can come this way, that way, a little bit. So we have to be prepared to expect some sudden bounces as well. But stick to the basics and try to make a good schedule for this coming month, and give your maximum effort, maximum time for this 1 month. And if at all, if you have some background knowledge, this 1 month is more than enough for you to crack the exams. That's my viewpoint.
Thank you so much, sir. I hope you have clearly understood what sir has tried to uh, communicate to you. Even a preparation for this month alone is sufficient if you are on the right track. Again, I understand that now many people would be having a lot of doubts, a lot of questions that are coming up, that you want some help. So we have, as a team, we have discussed, and we might start off a WhatsApp group where you can actually post your queries, and where we can actually get in touch with you guys as time permits for us, so with the answers, and we could try to help you to the maximum efforts that we can take. So it would be some amount of help for you during your preparation. So Yogesh would actually put forth a link for that, for the same. Again, for the other question that Ashirani had asked, yes, biostatistics is important. Some exams, they definitely ask some questions. Sometimes they might forget, so you might not even get a single question regarding that. So biostatistics, some basic knowledge about biostatistics is important. You have some MCQs again regarding biostatistics also in the app. At least the basic things like the measures the central tendencies and measures the dispersion, those things are important. Then, what are different sampling methods? What are different designs of clinical studies? So, at least you need to have some knowledge regarding that. If at all you come across questions or any doubts, you can actually put forth those in the group that we are starting. So that will help you. And we would like those people who are actually giving the present 2025 March exams to be part of the WhatsApp group. Because if you have so many people who are not appearing for the present exam, their preparation level would be different from those who are actually trying to prepare now.
Uh, yes, sir, I would like to add one thing. We also have biostatistics video within about roughly about 8 to 9 hours, done by our biostatistics faculty, Dr. Mukmoy. And all the topics that Deepak sir just mentioned are already covered. And if you're short on time, you can just run through the notes that are there for those videos as well.
Okay, good.
Yeah, again, one more thing, the figures, some plots, figures, they will just show and just identify this figure. So if at all you are not having time to see, just Google out for some plots like funnel plot, this boss, some plots are there. They will just show this plot, and then they might ask what is this. Similarly, for ultrasound images also, they might show some simple things, even hysterosalpingography images can come at least maybe around 10-15% because it's an online examination. Previously, with the print paper or earlier, you won't be getting so much images. Now the images are also even for FNB examinations or DNB examinations. The part which is played by images are keeping on increasing. So just prepare some image. Having said that, the names of the personalities, like who is this, those such things may not be there for the NEET SS examinations. And somebody was asking about trials. It is good that if you are knowing very important classic landmark trials which are mentioned in your OBG textbooks, not beyond that. Core infertility trials may not be asked. Sometimes one or two questions can come, but to select the best person. But spending lots of time to see the trial in detail is not needed. Maybe if at all you want to identify some important trials, I think Deepak had taken a class on trials, important trials. So just know the names and what is the main message or what is the main outcome of that trial. If at all you are knowing, that will be more than enough at this point, because uh, spending so much time on all these things might not give you enough weightage for those things in the examination, because you are having more important things which has to be covered in detail.
So again, as Sir has mentioned, uh, learning new things in detail would be very difficult in this 1 month. So basically, what you need to understand is you are having four choices. How will you zero it down to at least two out of four, so that you can make an intelligent guess out of the two? If there are you don't know any of these choices, then it would be difficult for you, and it would be a little tricky if you try to attempt to get the correct answer if you don't know any of the right choices. But if you want to choose one out of two, which you think are correct, so if you are able to equip yourself to actually come down to those two out of those four questions, that is what is going to help you out because of the knowledge that you have gained about certain things that are surrounding that fact. You might not be fully well versed with that particular question, the exact answer to it, but because of the knowledge of the things that you have gained about things around it, you might be able to discard many of the other options and then finally come to the question. So if you have at least you are able to disregard or disqualify two of the options. And if you have a confusion between two out of the four, definitely you need to actually take an educated guess and go ahead with those questions. But if you have no idea about any of those four questions, then taking a blind guess could actually be detrimental, and it might eat into your score that you have gained by with your good correct answers, because there is negative marking, as you are already aware. 4 marks for the correct answer, zero for unanswered, and -1 for the incorrect answer. So always be vigilant about these things. And usually, the if you talk about the mindset about attempting the MCQs, if you have read the question correctly, patiently, and the first answer that comes to your mind is usually going to be the right answer, but then it need not be correct for everybody. Otherwise, that would have been the real game changer, by the way. But then this is what is usually being said about how to tackle an MCQ question. So be calm, be patient. The level of knowledge that is required to actually pass this exam is not that great. It's not a very difficult exam, and but then it is a competitive exam, and each question, each score actually matters. So that is why the kind of tension or the kind of pressure that you feel is so great is because of the less number of seats and more number of candidates writing the exams each year. So just be cool, try to approach each question intelligently, and always keep some time towards the end so that you can go and review the questions that you have not attempted. That is to be reviewed first. And only then, if time permits, you review the questions that you have already attempted and whether you want to change the question that you have already given as the answer. So these are basic things that you need to cover. If at all you have any doubts regarding certain images, any questions, or you want discussion on trials, you don't go, as sir has already mentioned, not to go too much in depth. If you know some name, just what is it related to? That's is it an ovarian cancer, endometrial cancer? If I'm talking about gynae onco, you have trials in other subject sections also, but about onco, at least you'd be aware of what it is, where does it belong to. You might have some kind of googly questions always. It might be some drug or chemotherapy or targeted therapy agent which you have never heard of, and they might be asking something about that. Don't worry, if you have not heard about it, majority of you might not have heard it. Okay, so because it is a comparative kind of exam, it is not an absolute mark that is required for passing the exam. So again, uh, utilize the Marrow app MCQs and the grant tests that are actually coming your way. You will be given the schedule of when the grant test would occur, and keep in touch with the team members of Marrow, especially Yogesh, and also bring up your questions so that the faculty can also help you out in this preparation. Anything else, Yogesh?
Uh, so that's it. I think I've shared the WhatsApp group link. So I think out of the poll that we did, 26 people are attempting the exam on March, and
Okay.
13 are attempting for gynec-onco and 19 for reproductive medicine. So
Mhm.
those people can join the group, and then we can help them in any sort of way that we can.
It's okay if you are not able to apply to the poll right now. The app, the link is already being provided. You can join the WhatsApp group, but please keep in mind that we are looking for the candidates who are actually appearing for this March 29th exam. Because again, the preparation, everything would be different for those people who are actually appearing late for later exams. So we'll be taking it up like that. And again, we are not actually, because of want of time and because we don't want to dilute the messages right now, we will not be discussing about the preparation for exams like FND or MRCOG right now in this platform. This is basically for the NEET SS exam. Okay.
In fact, for those who are not attending this year, we are planning to come up with a bigger program to help you in preparation for HSS as a next step at the earliest. And as Deepak said, just 150 questions are there. We should, like any entrance examinations, you should not stop. Your time should not be over when you are reaching 140 questions, because 145 to 150 maybe just one liners and you will be knowing them very well. So at least it's very mandatory that you cover the full questions at least once and then go back, because if at all a long question is coming or something, don't spend so much time on that. Just put unattempted on that, mark it like that, and then proceed. So that this I need not tell this because already you had faced so many entrance examinations. The rule is same for any entrance examination. The same thing applies here as well.
Thank you very much, sir. Uh, but I don't know, all our candidates, every time an entrance exam comes up, there will be butterflies in your stomach, right? So again, don't worry at all. And we want a good result from our Marrow team here. Okay. So hope to see a lot of people gaining entry into the SCH programs, be it gynae onco or reproductive medicine. uh, and then hope all of you have a bright future ahead and start preparation. Okay, anything more?
And there was a question regarding which center is best, and all these things need not be discussed right now or thought of right now. Just concentrate on how to get the best rank within first 10 ranks or 15 ranks. Then only you need to think about which center is best, which is bad, which is worse, where you get good hands on. All those things we'll have a discussion later on if at all needed once you are in the rank list. Right now, don't think of any such things because it's not in our hands. Just aim for the first rank, all of you. Then you at least you can reach somewhere.
As sir has rightly pointed out, those sets of questions have to be discussed later at a later point. So there'll be lots of people who want to like think which would be best, gynae, onco, reproductive, or all those things. It is one of these things is one of the things to be kept in mind is that is a decision that you have to make on your own. But then don't fumble on such thoughts at this point. Give the exam. Anyway, you are appearing for the exam. You have some reasons why you need to write the NEET SS exam. Maybe it's you want to have excel in a particular specialty and go ahead in that and take it up as a career. Many of them might be scared of continuing in obstetrics because obstetrics is going to be a difficult career option, but I don't think so. If you take it well in your stride, with all the challenges, obstetrics, the core obstetrics is definitely a very good specialty. But there are some people who don't want to like toil too much into that and then expand further into subspecialties. They are also so you have your own reasons why you are taking up this exam. So now take up this exam. Once you clear the exam, then all the questions come up, as Sarah has rightly pointed out. What course, what are the fees, which is the place that I need to take up? All these things are secondary. So right now, don't boggle your mind with these kinds of questions, and don't let others also boggle you. What is the point in doing all these things? These are not the questions that have to be invited at this point. Okay. Yogesh, do you need to address anything else?
No, sir. I think all the questions have been answered, and I think almost 30 people have requested to join the WhatsApp group. 40 people. So we will
Okay.
approve all that request. So everybody will be within the group today itself.
Okay.
So
Please
yes,
check whether all of them are actually appearing for this month's exam.
yes, sir. Yes, sir. Will do.
Okay.
Yeah. Thank you
So,
both, sir, Deepak sir and Ramesh sir, for conducting this session. I hope it was helpful for everybody, and thank you all for joining in.
yeah. Thank you, all of you.